How will Europe cope with the mutant strains of COVID-19 now appearing in different corners of the world? The British or the Kent variant, those from Brazil and South Africa. There will be others. What kind of threat do they pose to the end of a pandemic? Very good to have your company. I'm David Foster. It is the natural evolution of a virus. It changes to survive. So how do scientists themselves change their responses to hopefully stay one step ahead?
As vaccines roll out and offer hope for a path out of the pandemic, new variants are emerging all over the world, and that could threaten that progress. The UK variant has been dominating the UK and has spread to more than 50 other countries. The South Africa variant has been found in at least 20 other countries. The Nigerian variant has been detected in more than 200 cases globally, and the Brazilian variant is now prevalent in the United States and South Korea, and present in the UK. Scientists are worried about these new variants, but are not surprised by them, as all viruses mutate in order to survive. The UK, South Africa and Brazil variants are apparently able to infect cells more easily and are more contagious. According to virologist Kirsty Short, variants will emerge and we need to closely monitor their spread. However, there's every indication we'll be able to adapt our vaccine strategies to protect against these and future variants. But major vaccine developers, including AstraZeneca, Novavax and Johnson & Johnson, found that their vaccines currently offer reduced protection to the South African variant. So what could a world of constantly changing variants look like? And what is the worst that could happen?
Let us welcome to this edition of Roundtable out of Leicester. We have Dr. Julian Tang, clinical virologist at the University of Leicester. We go to St Albans and say hello to Professor Jonathan Stoye, virologist at the Francis Crick Institute. And then we welcome Oksana Pyzik, global health advisor and lecturer at the UCL School of Pharmacy. As you know, please say whatever you want, whenever you want. I'll just try and follow a line of questioning if I can, but you may know better than me and decide that that question isn't worth answering. That is your call. But Julian, let me ask you, first of all, is there a European standard, a global standard, on how to deal with mutations?
Not as far as I know, actually. I think everyone's still developing their own plans in terms of how they react to variants, border control, vaccine redevelopment or redesign, and how they roll out these vaccines and the timing of this. Because, of course, once you start developing a new vaccine to cope with one variant, you might see another one, and you can't keep jumping between them. So I don't know of any criteria set in any country at which point you then have to redesign a vaccine and then the schedule for rolling it out, as well as the international border control. So no, I don't see any.
And the same, does the same go for identifying mutations as well as dealing with them once they're here?
Oh, identifying them is quite easy. You just do the viral sequencing. We now do full genome viral sequencing as a routine. The UK has done more than anybody else in the world in that respect, in terms of the number of sequences put onto GISAID, the open access database. You just have to register. But of course, there are always a larger proportion of viruses that we haven't sequenced or haven't even sampled that could represent variants that are out there that we just don't know about.
Yeah, I suppose, Jonathan, let me come to you on this one. Does that mean there may be variants out there, as Julian says, that we don't know about, but that are actually just as dangerous, if not more so, than the ones we are aware of?
It's entirely possible. And one thing I would say, add to what Julian said, it does take in this country nearly 2 weeks to generate a sequence. And that's one of the uncertainties about finding the missing patient or missing individuals with the Brazilian variant. We just don't know how many are really out there, and we are that little bit behind the times.
Okay. There is no world policy. Yeah, Oksana. Yeah, sure.
Yeah. So with the genome sequencing, yes, we need to increase capacity all over the world for this. We know plenty of countries are unable to do that at this point, but it's not just genome sequencing alone is not enough. We also need to be sharing those sequencing as well as collecting and sharing epi data, metadata on patient information, clinical information, all of that the WHO has flagged as not being widely available enough. So I think we definitely could improve the level of collaboration on this with the genome sequencing, but then all the surrounding data associated with that as well.
Can we talk about that in some more detail a little bit later on? I just wanted to get down to these mutations themselves. Jonathan, I read that there are more mutations possible than it is than anybody could actually count. It's only those that behave differently to the way we expect that we should be interested or concerned about. In what way are we talking about behaving differently?
Well, we're talking about mutations which give the virus a growth advantage in one form or another, either to spread faster or to avoid immune responses. Those are the ones that are of prime concern. A large number of mutations will occur which do not enhance the virus's growth, and they'll just be lost. So we don't need to worry about those. The question is how many of the mutations that can arise are of concern, and that we don't know yet.
Let's pick up on the three that seem to be in the headlines the most, starting with the UK, the Kent variant. How does that behave differently to the way you might expect?
So it grows faster. There are changes in the spike protein that allow it to recognize and bind to target cells more easily. So the virus grows better. The mutations that characterize the South African and Brazilian variants, they also have something that apparently gives a diminished response or diminished sensitivity to antibodies. And so they're a concern because they can, in theory, evade our immune system.
Okay, let's hear from Ursula von der Leyen, President of the European Commission. She's talking about the variants, the mutations, the specific ones, and how best to deal with them.
There's a growing COVID fatigue among our citizens. It has been a very trying year, but we should not let up now. Not only does the situation remain serious in many parts of Europe, but we must also watch out for the variants that are spreading. The B.1.1.7 is by now in all member states but one. The South African variant is in 14 member states and the Brazilian variant in 7. So there's a lot of challenge ahead of us.
Oksana, she says a lot of challenges ahead of us. What specifically would those challenges be?
Well, I think what a lot of countries are failing to grasp is that these variants and vaccine and viruses and all of this is really inherently tied together. So if you can't solve the issue of variants without also solving the vaccine inequity problem. And currently, we have in the UK, for example, over 20 million vaccines that have been administered. And this is absolutely a fantastic result, but it's short-sighted in the sense that if we look beyond our own borders, in those unvaccinated populations is where more variants can emerge. The more time that we allow for the virus to transmit, there are more opportunities for it to mutate and then come back to our shores in a different form. Now, right now, it looks as though the main dominant forms of the variants in circulation, our vaccines look sturdy. They look robust. They look like they can, across different age groups and demographics, still protect us from the worst outcomes, hospitalization and death. But as some countries may not have vaccines until or fully vaccinate their populations up to a herd immunity level, 2023, 2024, that's just going to invite potentially more dangerous variants back to the UK and Europe.
So travel is the key, is it?
Yes, I think if you open up international borders, you're going to get importation, exportation of different variants around the world. And to some extent, this may be inevitable anyway. And just pick up on Oksana's previous point is that it'd be ideal to roll out the vaccine across all countries at the same time in parallel and kind of suppress all that viral replication so there are no hot pockets anywhere in the world. But clearly, logistically, that's very hard to do. And most of the Western countries were actually having high replication, high case numbers, high death rates, more than the Southeast Asian and even the other developing countries for many parts of the year. So they were clearly prioritizing themselves for the vaccine. But once we get more control of the virus, then I think rolling out the vaccine to the other countries where there's no vaccination program just yet would also suppress these variants coming back to the UK.
Jonathan, you spoke in an earlier program about the Brazilian variant. You said you were not that concerned about it. What about the South African one?
Again, at the moment, none of these mutations appear that bad. I mean, relatively bad. So you could, if you want to be optimistic, you say that, and this is very risky, I know, but if you want to be optimistic, you say that the mutations that can occur to lead to escape have occurred, and there won't be that many more. Now, we don't know whether an escape, a virus will arise that can escape from the vaccines that are currently available, but it could easily be that none will. So, under those circumstances, we just need to get the current vaccine out as fast as possible.
So can I be clear on this? When you're talking about a virus will appear that can escape, you're talking about a new virus or a mutation of the current one?
Well, that, for me, is as big a worry as any, that that more viruses will come onto our radar. There was a wonderful review written in 2010 that predicted when, not if, being the question for the next coronavirus epidemic. I would re-emphasize this. There are still lots and lots of unknown coronaviruses, and those are the ones that perhaps we should be more worried about.
How would they escape? Would it be because of something that has happened during the current pandemic, or are they just sitting there lying dormant, waiting for an opportunity?
Well, they're sitting
Help me with this.
there, and they might begin to get a foothold in the human population unnoticed because they're under the smokescreen of these other viruses.
And that is because we are behaving in a certain way. We're traveling to different countries. We're indulging in pastimes that would actually make us more likely to be exposed to this, and they would then, the viruses, take advantage of that.
And we're impinging on the environments of the bats and other animals that might be hosting these viruses.
Oksana, do you share the same concerns?
Well, certainly. I mean, with the rise of megacities, we are encroaching into natural animal habitats, and even practices such as exotic food markets, etc. The WHO has had outbreaks of infectious diseases as one of their top 10 threats on their lists for decades, and it's governments that have perhaps, well, we can see, not prepared to the extent that was needed. At this stage, certainly I think that we can do more with the global vaccine rollout. We had the WHO Director General call for wider vaccine equity, not just in words, but in concrete actions. But what that takes is ensuring that perhaps we can get some technology transfer and temporary waiver of intellectual property, which currently a lot of countries are resisting, even though there is a provision within the TRIPS agreement, that's a trade agreement, and through the WTO, this action to help scale up more vaccines via increasing production, getting partners on board, could be one way to ensure that we're getting that equal coverage faster. It's a war against variants versus vaccines, and we need to do it as fast as possible.
Can I, at this point, bring in Professor Stephen Powis, who's the National Medical Director of NHS England? He was talking about vaccines that can be quickly altered to tackle the virus. We've gone into that on another show, but I have a question to come off the back of this quotation. He said the new vaccines which are being used for COVID-19 can be adapted very rapidly, so it's likely that if we do need to change the vaccine, that can be done in months rather than years, which was the case with the more traditional vaccines. My question is, are we able to predict, or will we be able to predict, how a virus will mutate and thereby stay one step ahead of the virus? Julian.
Well, I would say no to that. It's very hard to predict how a virus will mutate. If we could do that, we would have done it for flu, decades ago, and be ahead of the virus all the time. I think with flu, we just look at the previous 6 months surveillance around the world and try and adapt the new vaccine each year for the most prevalent virus that's circulating at that time. For RNA viruses, this is quite tricky to do, even for coronavirus, which has some proofreading enzyme capability. I don't know what Jonathan thinks about this, but I think we're always chasing the virus when it comes to vaccine design, unfortunately.
Okay, why can't we work this out when we can see pictures coming back from Mars, when we have got artificial intelligence helping us with almost everything, when we have algorithms for this, that, and the other? Why can't we?
Jonathan,
some of the experiments we just can't do. There are experiments called gain of function experiments that you become very reluctant to do because you don't want to try and generate new things which are more infectious or more dangerous beforehand because there is a fear that they could escape. So that's one of the reasons why some of these, some approaches to trying to look at new variants just don't work.
And is that one of the reasons why some people think it may have escaped from a facility in China where they were carrying out perhaps such experiments?
So the WHO investigation has really kind of neutralized that theory. They think more likely.
Well, an awful lot of people have rubbished the WHO investigation as well, haven't they, Julian?
Okay, so let's just take it at face value for the moment. I mean, a lot of the data they were looking at was presented to them. Okay, so they had a certain restriction. I know some of the people there, Dominic Dwyer and Marion Koopmans, and I think the main thing was that the other zoonotic origins may be more realistic than escape from the lab or deliberate release, for example. And we know from the previous zoonotic viruses like MERS, SARS, avian influenza, this can happen in the natural world with human encroachment, quite simply.
But the kind of experiments that Jonathan was talking about, the ones that are too dangerous to try, are they possibly the sort of things that were going on in this research facility?
I think that's very unlikely. But
they don't think so based on the data they were presented, but I can't exclude that. I don't know what Jonathan would say about that.
Well, I think also just the fact that they had 4 main hypotheses, and that was one that they included. And then they said they came to the conclusion it's the least likely of those 4 hypotheses means that, accidents can happen. And, it's not within outside of the realm of possibility. It was one of the 4 hypotheses. It's just the one that they have decided is the least likely to have occurred. But I think it's important to note it was on that list of possibilities.
Yes, it's still on the table.
Yeah.
It's still on the table.
So
that possibility is still considered. It's not been ruled out. They think it's the least likely.
Okay.
So this has happened. This has happened before. Jonathan knows back in 1977, the seasonal H1N1 virus was released from a Russian lab accidentally, and this was a derivative of the original 1918 Spanish flu that came back and co-circulated with H3N2 since 1977. So this can happen, and that's why they've been looking at it. But I think it's a bit unlikely. I mean, why would they do that unless it was a pure accident? It doesn't really make a lot of sense.
No, it doesn't make any sense deliberately, but it could well have been an accident. A lot of people are positing. If we are to prevent this sort of thing happening again, and an awful lot of people, yourselves included, I think have suggested that these things are pretty much inevitable. But if we are to lower the incidence of such global viral pandemics, how do we go about it? Oksana, your thoughts? Anybody else?
Well, I think there are big things that we need to do. One of them starting off with ensuring that we are thinking about this holistically. So all of that destruction of the environment, all of these things are contributing to that factor. We also, and this is ongoing anyhow, need to step up the monitoring of vaccines and ensuring that our agricultural practices aren't encouraging that, and that these animals are being vaccinated appropriately. And there's again, extensive effort on that, as well as the types of foods that are being sold in different places all around the world to ensure there's appropriate hygienic standards in place for that. But this is not a simplistic issue. It's integrated with a lot of other things that will mean that there isn't any simple solution. But I think previously we even have these types of exercises to see how countries would respond, like a run through. And during these exercises, which were supposed to signal how we would cope in a pandemic, lots of problems were identified and then not actioned on. And that comes down to prioritization, funding, and political will. So I think, I don't think there is one thing alone that can prevent it, but a series of actions that need to be prioritized in our country's governments and global international community.
Any thoughts on that, Jonathan?
Well, you need openness, but you also, you don't want to have people scaremongering. So you need to be able to respond rapidly to new cases of unexplained disease. And that's, I think, what didn't happen this time around with the virus. There wasn't a rapid response, a rapid open response to the initial cases of human disease. And that's one area that we could hope to improve.
Which brings us back to mutations. If you're talking about scaremongering, and some of the headlines initially were that these mutations were much more deadly than the original coronavirus that we were talking about 12 months ago, and turned out not necessarily to be the case. What do you make of that response?
Well, can I just add to that previous comment on that question? I think you need to look at two things. One is the cultural impact. I mean, countries like Africa and Southeast Asia, they have bushmeat, they have wet markets that have animals introduced to human populations in very close contact. And the second is the political will to actually react to those first signs of a virus emerging, which places like the UK and Europe did not respond to very quickly. And similarly to the new variants coming into the UK, again, the UK response has been relatively slow to see how does it pan out before we do anything. And for a virus that spreads this quickly, this is going to be a problem because you always end up seeding more cases than you think you have by the time you realize it's time to do something.
But equally, if you reacted to each variant immediately and brought in a lockdown each time you heard of something new, it would be never ending, Julian, perhaps.
Right. So you need to find some kind of key indicators where it looks like it's going to spread beyond just a small limited outbreak. And in fact, we've actually submitted something to this effect to one of the postgraduate journals looking at this. So, for example, if you look at Wuhan, first of all, the WHO looked at assigning a fake health emergency of international concern when they saw a rapidly spreading virus amongst humans in China. And then they waited for a while before declaring a pandemic. And they waited until they saw a rapidly spreading virus between humans outside of China. And then they had to then decide what to do, which took another 3 to 4 weeks. Even New Zealand, who's done really well, took about 4 weeks to respond to that initial pandemic declaration. So I think there's a certain level of experience that you need. Like the Southeast Asian countries locked down really quickly. Universal masking came on very quickly. And New Zealand learned from the Southeast Asian response. And then there's the European and North American response was that, let's wait and see whether it comes here in any big way because of this kind of idea it's a Chinese or Southeast Asian virus that they've seen before with MERS and SARS.
Time is against us, I'm afraid, so we're going to have to sort of wrap things up. And here's a provocative one for you. Oksana, you can kick this one off. Given the terrible death toll that there has been, could it have been a great deal worse without these scientific advances?
Oh, certainly. I think that we found dexamethasone, steroids, we had clinical lessons, and all of that meant that the survival chances have increased, although, again, there is worse health outcomes that are associated with variants. And overall, I think that, with the vaccines that are being rolled out, if we had no vaccine, that could have been one of the end results. This could have been dragging on for much longer and with much higher death rates.
And Jonathan, in terms of where we are and where we go from here, your thoughts about generally, have we been lucky in a way?
No, I don't think we've been lucky. I mean, as one of the grey heads on this program, I look at the developments over the last 40 years. When AIDS came along, it took us months or a year and a half to identify the causal agent, and we still haven't managed to make a vaccine against that. With viruses, with time, we've got much faster and much better at identifying causal agents, and this epidemic has shown that it is possible to make a vaccine in a short period of time. So I think I'm optimistic for the future.
Yes, as one of the grey hairs, your opinion certainly does count. One of the grey hairs, not the only grey hairs on this program. Thank you very much indeed to all three of you, and thank you wherever you happen to be picking up this edition of Roundtable. You can go to our YouTube channel, that's TRT World Roundtable on YouTube, to get this show and a great many more. We hope to have your company next time. Until then, goodbye.